about an incredible, life-changing, transformative program that these two fine individuals are involved in. It's my pleasure to introduce you to Dr. Mark Wolff. He is the Associate Dean at the NYU College of Dentistry. And Dr. Josephine Chang, you are a fourth-year dental student there at NYU. So congratulations on that, getting into dental school and being part of this program. So what inspired you to first start this program?
This was an inquiry about, is it possible to help some people that were very badly injured in international torture? And once we understood what they were looking for, it became obvious that we would really like to do something to help change these people's lives.
And as I mentioned earlier, the numbers are between 75 to 90,000 victims of torture who have sought refuge here. New York apparently has, with Metropolitan Home, I guess, to maybe the largest number of torture survivors in the nation. And this is according to the Bellevue NYU program for survivors of torture. You help those who have been electrocuted, suffocated, or burned in the face, and you come in and help to transform their faces and their mouths.
Physical mutilation, hit with butts of rifles, beaten badly, teeth knocked out of their mouth, teeth extracted without anesthesia as part of the torture, just broken off to elicit the most pain possible. These are people that have been abused in the worst ways that we can imagine.
It's very sad. It's very disturbing. And I want to mention your website, www.nyu.edu/dental, right? And they can go on there for more information. Now, we've got a map here that I'd like to show as well. And there's the website up for the viewers to see. But the map of the countries of the victims, some of the countries: China, Cambodia, Yemen, Iran, and Russia.
Tibet, Nepal, many of the west coast of African nations, the Congo, sub-Saharan Africa. We have people that come from literally all over the world who have been injured.
And probably some of the most challenging cases you've seen in your life, I imagine, right? And just in terms of the nature and severity of some of the injuries and the trauma?
The dental trauma isn't the challenging part.
What is?
It's the people.
Really?
These are people that may be afraid to stand under bright light, may be afraid to have anybody touch their mouth. They've been violated and hurt. We have to earn their trust. It's very different. And then put language barriers, social barriers, and a number of other things together. It's a very challenging environment.
Team approach. Josephine, when did you first become involved in the program, and tell us a little bit about your experience working with these survivors?
Well, I started observing in the clinic last year as a third year, and this year I was accepted into the program because we have to apply to be in this program. So there's only 12 of us who are involved. And when I heard about it, I had to be involved in this program because of the great things that are done and how closely we work with Bellevue. It's just an amazing program and an experience that we can't get anywhere else.
Tell us about a case in particular that really struck you, that was, emotional, powerful, that you felt you were able to make a difference in this person's life.
Well, today actually, I just treated a patient and I delivered 4 veneers for a female patient of mine. She suffered from a rifle hitting her front 2 teeth, and so we had to restore those teeth for her. And in addition, we transformed her smile. We just added on a couple more teeth to restore, and she walked out more confident than ever, and she's ready to go for interviews, and she's so much happier with herself.
And where was she from? Where this happened? She was injured, do you recall, with the rifle?
I actually don't recall.
But you recall the smile and how happy she was when she walked out. Well, and psychologically, it seems like it's pretty much like an instant lift, that helps them feel better about themselves, like you said, where they can go out and do a job interview and not have that shame and that embarrassment.
Right.
That's a reminder every time when they hesitate to open their mouth to show somebody, or and people might think, oh, that is not very friendly, or this person's this or that, but you don't know the story behind it, and they're hiding their shame, in their mouth.
And that's with a lot of our patients. They're very, very quiet. They don't like to talk about what happened to them, and so along with the dental treatment, we get to learn their story, and as they develop our trust, we learn a lot more about them. And, you know, it's not only just about treating their mouth, it's about helping them find jobs and helping them feel comfortable about themselves.
Now, so far your program has reached about 2,400 visits on nearly 500 people.
Absolutely.
So that's such an impact, and it sounds like the need is quite great. Do you have plans to expand the program?
We are planning next year to almost double its size.
Oh, great.
This is sponsored by the College of Dentistry. These people come into a medical program that provides psychologic, social work, and medical counseling and work through Bellevue. Dr. Alan Keller had started this program many years ago there and done some remarkable things. Needed the dental component, and 2 years ago, almost 3 years ago now, we started the process.
Right.
And we've become so busy that we're adding more people in place and planning to actually expand the program. The College of Dentistry at NYU actually sponsors this regardless of patients' ability to pay if they qualify.
Which is so incredible. So you don't turn anybody away for lack of financial resources, which I imagine you're dealing with people who are really suffering and don't have the means otherwise to get this done.
If you qualify as a survivor of torture, we'll see to it that those teeth are taken care of.
Well, that's incredible. What an incredible mission you have. And I know we have a before and after picture, and perhaps you can tell me about this patient as we take a look here.
This was a patient who was struck by a rifle butt, and knocked out the tooth, damaged the tooth next to it. And that tooth was replaced, if I'm correct, by an implant. It was done by one of our students. If we can show the after photo there. You can see the transformation and the restoration of the teeth.
Beautiful, perfectly matched.
Yeah, there's no denial that you've restored a smile, and that makes it possible for a person to function in a totally different method. So that's a remarkable,
it really
remarkable
is
change.
So wonderful. Now, are you able to kind of keep track of some of the patients, what they can go on to do? Some of them, do they actually get jobs, and their life becomes better for it?
They come back smiling and
Big
happy
smiles.
and speak with us about it, and we're doing a little bit to try and restore their person, their soul a little bit to show them that humanity can treat them well.
Which is incredible. I work as well with Operation Smile, which is another great group.
Oh,
I mean,
wonderful.
Yeah, it's just really life-changing, especially for those, children that are able to get the surgeries. And, I just say, it just breaks your heart when you see somebody like that. It just affects you so badly that you feel so uncomfortable and nervous and just, insecure about yourself to be able to go and even do a job interview or have a conversation with someone, and you can really live kind of like a sheltered, shameful life. Kids and stuff that have those problems, like they don't want to go to school or interact with peers because they're teased or you're made fun of, or people think, oh, is this person a homeless person, this person not smart? They make all kinds of judgments because why is that person missing teeth, or what's wrong with them, right?
It's absolutely terrible, and by altering the smile, by training dental students who go out to be dentists who can do this, we have the effect on thousands of people, not just the ones that we see today. These students are going to come out trained to really affect people for their lifetime. Which
is incredible. And they'll want to reach out and help others as well. Well, the program you do is inspirational. I couldn't be more proud of you guys. Thank you for coming on here and continuing, I hope, going forward, the hard work that you do that's really giving, really nice. And I hope you get to double your program, get more fantastic students like Josephine in who are passionate about helping others. I love dentists. I love going to my dentist. Okay, can you tell?